So we're continuing our chat about training older women, and this issue has come up like almost every week since we started this topic, and that is the pelvic floor, or I like to call it the deep core, because the pelvic floor muscles are actually 5 layers of muscles that come up through the pelvis, and there are 14 distinct muscles that don't just sort of go left to right, but go down and up, across, forward to back, figure of eights, circular muscles. Like, it's quite a complex muscle group all contained within that pelvis. So I call it the deep core. In the same way, the pelvic floor is not an isolated muscle group. When you're training your abs, if you really want to call it core, you've got to train the entire trunk. Then it's core. So the pelvic floor I call deep core because we want to use the multifidus along the spine. We want to use all the stabilizer muscles of the internal automatic balance muscles, right? Reactionary muscles. So after menopause, a female's soft tissue becomes less elastic, which can change the pelvic floor and their posture, not necessarily for the worst. Okay, if someone's been hypermobile their entire life, then having a stiffer structure might actually be beneficial for them. However, it can add downward pressure to the pelvic floor. So if they become actually stiff through their ribs, then when they breathe, instead of expanding out and in with each breath, the rib cage, their organs drop down and up because the ribs are rigid. And what that does is put extra pressure on the pelvic floor. Now, if the pelvic floor isn't sort of moving like a piston or a pump, kind of like the diaphragm moves with the diaphragm, then it will be overcome with intra-abdominal pressure. And that can cause problems, okay? Again, or changes, because there's no sort of right way of progressing through menopause and no single way that women experience menopause. You know, we've all got different issues beforehand. We're going to have different changes and issues afterhand, new word. Okay, because estrogen directly affects the structure and the function of bone, muscle, tendons, and ligaments. It is not just a reproductive hormone. Now, with the decline of estrogen at menopause, women experience a rapid decrease in muscle mass and strength and will be at more risk of muscle injury. That's if they haven't been training. Okay, so you can change this. And this includes the pelvic floor muscles, which may have already experienced injury or just strain. They might be overstretched due to pregnancy or birthing her babies, or an underlying condition such as chronic coughing or constipation will put similar pressures through the pelvic floor and become a similar risk for developing dysfunction in the peri to postmenopausal period. So what this means is menopause alone is a risk factor for developing stress, urinary incontinence, prolapse, and other pelvic dysfunctions. But not everyone is going to develop them, okay? There is a lot you can do about it. Now, pelvic dysfunction does not always need strength training. So, you know, when we were talking about the hypermobile woman becoming stiffer and that actually helping her system, it's the same sort of principle, the same sort of principle that, you know, if estrogen acts on bone, muscle, tendon, ligament, and it is rapidly declined, then a lot of the experiences she's going to have with her pelvic floor in the postmenopausal period will be related to her experience during her menstruating years, okay? So some pelvic floors will need releasing and mobilizing. Some pelvic floors will need relaxation training, down training, and others will need strength training. So when you're going to lift heavy with your perimenopausal women and you're going to do plyometric training and load their skeletal system in a variety of ways, then you have to address the pelvic floor first. It's the same as if you want to lose weight with women, you have to address their hormonal balance first. And you cannot do this without a women's health physio. It's a must. It has to happen. So step one is get an internal examination by a pelvic physio and follow their recommendations. So they'll be able to tell you if they're hypertonic, or if they're stretched and need, lengthening. I mean, shortening, strengthening. If she's got a long, a lax, or a detrained or disconnected pelvic floor musculature, then we strength train them, we connect to them, we drive that highway, and we move them in a variety of ways with our brains connected to the pelvic floor muscles. I know it sounds weird. If she's tight, locked on, or she's stiff, then relaxation and mobility are more appropriate. So you need to get these qualifications. You need to understand what that means for the body in front of you. Any improvement through posture and mobility through her thoracic and her femur in her hip joint will improve coordination and mobility of the pelvic floor, and will also improve downward pressure or release pressure on the pelvic floor. And then you need to understand if she has injury, including scars or nerve damage, and you need to follow the physio's recommendation for those things, and keeping an eagle eye out for red flags. So you need to be conservative if you're training someone with a pre-existing injury. And it's part of why the physio is just important in this interaction. And then get her reassessed regularly, because at best you'll be able to see how much she's improved and what your movement prescription is doing for this body. And at least you'll make sure you're not making things worse, okay? Because heavy lifting, power training, plyometric training, they are high risk for developing pelvic floor dysfunctions. They will exacerbate existing pelvic injuries. And we need to factor that in if we want our women doing these activities. So you cannot assess the pelvic floor. You cannot stick your hand anywhere near their vulva or their vagina, which means working with a physio is just the way it's got to be. With exercise being the number one strategy for anti-aging and anti-disease, but then the number one barrier to exercise for women being pelvic floor dysfunction, there's really no way of getting around this, okay? And then the peri to postmenopausal period, that is just a time where it changes, okay? For better, for worse, we don't know. But you need to be aware it's going to change, and awareness in what the red flags are and what this looks like in your clients. If you truly have their best intentions or their best interests at heart, then that's just what you got to do. All right.